Welcome to this episode of ECGs Made Simple. Now, if you're just stumbling across this video, make sure you subscribe and check out the other episodes. With that out of the way, let's get started. Now, this rhythm, unlike the last one, is one that you're going to commonly come across in EMS. And at a quick glance, even if you have no training, you probably see a few things off. So let's follow those 5 steps and see where it takes us. Well, we have a rate of 7 complexes times 2, which is 14, so we end up with the rate of 140 again. Regularity, let's check that. It does not appear to be regular at all, so we're going to go ahead and call this rhythm irregular. Matter of fact, we're going to call it irregular. The P waves present and upright. There is a lot of squiggly lines, but none of them that would really constitute a P wave. So we're going to say no. The QRS complex is, we're good there with 2.5 blocks again. And then we're going to check the PRI. Well, how do we measure the PRI without a P wave? So we don't have a PRI. Now, this rhythm is called atrial fibrillation. So let's take a break from the rhythms and talk about how atrial fibrillation works. In atrial fibrillation, you have so many groups of heart cells that are trying to take the job of the SA node that about 300 pulses a minute are going through the atria. That's more than the AV node can keep up with. So it allows what it can get through. There's way more stuff going on, and the atria end up just fibrillating, and they don't actually get the chance to contract. And because the AV node's getting hit with so many impulses, these rates tend to be on the fast side. Now, it doesn't have to be fast, but most of your AFib patients are going to be fast. But the hallmark is the irregularity. That's because of these 300 pulses, the AV node is grabbing different ones every time, so that the timing from the atria down to the ventricles is constantly fluctuating. So their heart rate is irregular. You're not getting a P wave because you're not getting contraction of the atria. You're just getting that fibrillation of the atria. Now let's move on to the next rhythm. So this is a pretty uncommon rhythm in the field, but it is very, very noticeable. Notice those P waves right off the bat. Now this rhythm is atrial flutter, and it's notorious for having those sawtooth P waves. Those are P waves, but you have 2 or 3 or even 4 per QRS. Matter of fact, when you document this, you're going to document how many P waves you have to QRSs. So let's go ahead and work our way through the rhythm. We got a rate of, looks like it's just barely 120. So let's see if it's regular. We'll pull out our handy dandy paper. Yep, looks regular. We can call that regular. Are the P waves present and upright? Yes, but there's 3 P waves to every QRS, creating that sawtooth pattern that we're looking at. So we're going to say yes, but we're also going to add a 3-to-1 ratio. Now let's check our QRS complex. Look at that. It's a little narrower than the last few we've had. That's 2 small blocks. So we're going to call that 0.08. And we'll check our PRI. That P wave just merges right into that QRS. So we can't really document a PRI. But this is atrial flutter. And the hallmark of atrial flutter is those sawtooth P waves. And that's it for this episode of ECGs Made Easy. Now, to catch our other episodes, go ahead and click right here, and I'll see you over there.